Namaste Bitiya. Hamesha Khush Raho Bitiya. A very good morning to you all. Myself, JV and Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In today's lecture, we are going to discuss about the headache. In the last lecture, we have discussed about the introduction to the neurology, and I believe that you must all have gone through the books of anatomy and physiology from the first year. So let's start with headache. Headache is a very important disease with which lots of people, almost all of us have experienced in some or the other part of the life. So what is headache? What are the different classification of headache? What are the different types of headache? All these things, how to diagnose a particular headache and how to manage it. All these things we are going to discuss in today's lecture. So what is headache? Headache is a symptom of pain anywhere in the region of head and neck. So what is headache? Headache is basically a symptom of pain anywhere in the region of head and neck. So if we are talking about pain in the region of head and neck, then it is known as headache. And it is basically a multifactorial origin. So headache is basically multifactorial in origin, and it can be a sign of stress or emotional distress. So what is headache? It is a symptom of pain anywhere in the region of neck and head, and it has multifactorial origin. So the origin of headache, it is multifactorial, and it can be a sign of stress and emotional distress. So what is headache? It is a symptom of pain anywhere in the region of neck and head, and it has multifactorial origin, and it can be a sign of stress or emotional distress. Or it can result from the mechanical disorders such as migraine or high blood pressure, anxiety or depression. So what is headache? It is a symptom of pain anywhere in the region of head and neck, and it has a multifactorial origin. It can be a sign of stress or emotional distress, or it can also result from any of the medical disorders. Medical disorders like migraine, high blood pressure, anxiety or depression. So what is headache? It is a symptom of pain anywhere in the region of head and neck. It has multifactorial origin and can be a sign of stress or emotional distress, or it can result from the medical disorders such as migraine or high blood pressure, anxiety or the depression. A painful sensation in any part of the head ranging from the sharp to dull pain that may occur with other symptoms. So headache, it is a symptom anywhere in the pain in the region of head and neck, and it has a multifactorial origin and can be a sign of stress or emotional distress. It can also result from different type of medical disorders such as migraine or high blood pressure, anxiety and depression. It is a painful sensation in any part of the head, and it can range from the sharp pain to the dull pain. So dull to sharp pain, it can have a variety of range, and that may occur with other symptoms. The most common reasons the patient seek medical attention and is responsible for more disability than any other neurological problem. So the most common reason for which the patient is seeking medical attention, it is headache, and it is responsible for more disability than any other neurological problems. Now, classification of headache. What is headache? International Headache Society has classified headache into two parts. So International Headache Society has divided the headache into two parts. One is the primary headache and the second one is the secondary headache. So primary headache is one in which the headache is associated with features and are the disorders in itself. So primary headache is one in which the headache is associated with features and are disorders in itself, and they are not the result of any other medical condition. So primary headache is one that is associated with features of disorder itself, and it is not due to any other medical condition. Whereas secondary headache is one that is caused by the exogenous disorder. Any other type of disorder, any other exogenous disorder, when it is caused by any other condition. So we have primary headache, we have secondary headache. Primary headache in which these are the disorders in itself and are not result for any other medical condition. Whereas secondary headaches are those which are caused by the exogenous disorders and when it is caused by any other condition. Next, we come to the classification of the headaches. So first of all, we are going to classify the primary headache, and then we are going to classify the secondary headache. So what is primary headache? Primary headache is basically a tension type of headache. It occurs in around 69% of the patient. So most common type of headache that we are going to see in different type of people or the general population is the tension headache. Tension headache is occurring in around 69% of the population. Next common type of primary headache is the migraine. Migraine is occurring in 16% of the patient. Then the third variety is the idiopathic stabbing pain. When the cause is not known, but there is stabbing pain that is felt, it is felt in around 2% of the population. Exertional pain, it occurs in around 1% of the population. We have cluster headache that occurs in around 0.1% of the population. So most common type or most common variety of headache or of the primary headache that we are going to see is the tension type of headache that is occurring in 69% of the patient. Next common variety is the migraine. Migraine is occurring in around 16% of the cases. Idiopathic stabbing pain that is occurring in 2% of the patients. Exertional pain that is occurring in 1% of the patient. Next, we have cluster headache that is occurring in around 0.1% of the patient. Now, the primary headache is resulting in considerable disability and decreased quality of the life. So whenever a patient of primary headache is coming to you, it is often having, the patient is often having a considerable disability and the quality of life is disturbed. Next, we come to the secondary headache. What is secondary headache? Secondary headache occurs due to the systemic infections. Systemic infection, it is seen in around 63% of the patient. So secondary headache is the most common cause of secondary headache is the systemic affections that is occurring in around 63% of the patient. Next common cause for secondary headache is the head injury that is occurring in around 4% of the patient. There are various vascular disorders that are occurring in 1% of the patient. Subarachnoid hemorrhage that is occurring in less than 1% of the patient, and brain tumor accounts for around 0.1% of the cases. So the secondary headache, it is most commonly seen in systemic infection. It is seen in around 63% of the cases. Head injury in around 4% of the cases. Vascular disorders are seen in around 1% of the cases. Subarachnoid hemorrhage less than 1%, and the brain tumor that is seen, that is responsible for 0.1% of the cases of headache. So we have discussed the various causes of primary headache and the secondary headache. Primary headache, the causes for tension type, migraine, idiopathic stabbing, cluster, and exertional. Whereas in secondary headache, we have systemic infections, the most common cause, head injury, vascular disorders, subarachnoid hemorrhage, and the brain tumors. Now, what is the physiology of headache? How the headache is occurring and what are the different things that are occurring in headache? So in the physiology of headache, the pain usually occurs due to. So what is the main cause of pain in case of headache? The pain is usually due to stimulation of the peripheral nociceptors. So there is stimulation of different type of nociceptors or the pain receptors in response to tissue injury. So there are different type of peripheral nociceptors or the pain receptors that are activating in response to the tissue injury. There are visceral distension and the other factors. It is a normal physiological response that is mediated by healthy nervous system. So pain, actually, if we are talking about pain, then pain is a good thing. But if it is occurring regularly, then it becomes problematic for us. So pain usually occurs because of the stimulation of the peripheral nociceptors that are known as pain receptors in response to the tissue injuries. There are also visceral distension or the other factors. And it is a normal, pain is usually a normal physiological response that is mediated by healthy nervous system. Now, damage or inappropriate activation of pain, it is producing pathways of the peripheral or central nervous system. So damage or inappropriate activation of the pain producing pathways or of the peripheral or central nervous system is again responsible for development of pain. Headache may originate from either or both of the mechanisms. Now, how to evaluate a case of headache? Whenever a case of headache is coming to us, how can we do clinical evaluation? Now, this is very important to understand or to reach at a particular conclusion. New or severe headaches has a differential diagnosis that is quite different from the patients with recurrent headaches. So if a patient is coming to us with new or severe headache and had a differential diagnosis that is quite different from the patient with recurrent headache over so many years because of the probability of finding a potentially serious cause of new disease. So if there is a new case or severe headache, it has a differential diagnosis that is quite different from the patient with recurrent headache. So both the things are different. If we are having an acute headache case, a new headache case, it is totally different from the case of recurrent headache that is occurring over years because of finding a potentially serious cause. So serious cause, when should we consider a serious cause in case of headache? Serious cause is to be considered in case of meningitis. If a patient of meningitis is coming to us, subarachnoid hemorrhage, epidural hemorrhage, subdural hematoma, glaucoma, tumor, and pleuritis sinusitis. So when should we consider a serious cause for a headache? So headache serious cause is considered in cases of meningitis. It should be considered in case of subarachnoid hemorrhages, in epidural or subdural hematomas, glaucoma, tumors, and purulent sinusitis. Now, how to take the history of a case in the case of headache? So whenever a case of headache is coming to us, how can we take the history, or what are the different steps of taking history? So history taking, first of all, we have to check for the overall pattern. Overall pattern that involves intermittent or continuous. So the pain can be intermittent, it can stop and can start again, or it can be a continuous pain. The speed of onset. So whenever we are taking the history of the patient related to the headache, then we have to check whether what is the overall pattern of the patient, whether it is intermittent or continuous. What is the speed of onset, whether the speed is very fast or slow, the time or day of the onset of the maximal pain. At what time of the day the patient is experiencing maximum pain. The effect of the posture. So what is the effect of the posture in headache? Cuffing and straining. So whether the pain is aggravated by any particular posture or cuffing or straining, the location of the pain has to be inquired for. Whether the pain is frontal, occipital, temporal, what is the location of the pain? And you have to inquire for the associated symptoms. So during the history taking, you have to check for the overall pattern of the pain, whether it is intermittent, whether it is continuous, what is the speed of the pain, whether it is coming suddenly or slowly, insidiously, the time of the day and the onset of pain, at what particular time of the day the pain is maximum, what is the effect of posture, that is cuffing, straining, on the pain, whether it is increasing or decreasing, and what is the location of the pain, at what site, at what particular site we are getting the maximum pain. The location of the pain. So what is the location, what is the exact location where we are getting the pain, and any associated symptoms, if we are getting any associated symptom of the pain. All the things we have to inquire for. Now, what are the various investigations? Whenever a patient of headache is coming to us, what are the different type of investigations that could be done in case of a headache? So first of all, we have to go for complete neurological examination. Whenever a patient of headache is coming to us, we can go for complete neurological examination, and it is an important tool for the evaluation of headache. So complete neurological examination is must. Then if the examination is abnormal, if the examination that we are doing is abnormal, or if there is any sort of serious underlying cause that is suspected, then an imaging study like CT or MRI is indicated in the first step. Then we have to go for the lumbar puncture. Lumbar puncture is required in case of meningitis, that is stiff neck and fever. And next, there are various psychological states of the patient should be evaluated to prevent depression. So what are the various investigations that could be done in case of headache? We have to go for complete neurological examination. That is important in the evaluation of headache. If the examination is abnormal or serious, then we have to find out the underlying cause. Then imaging studies have to be done like CT or MRI. It is indicated in the first step. In the advanced stages, or in the cases like meningitis, stiff neck and fever is there, then we can go for lumbar puncture. There are various physiological states of the patient that should also be evaluated to prevent the depression. Now, in the on the portal, the e-notes I have uploaded, I have uploaded a case that is needed to be evaluated. So you have to go through that particular e-notes and you have to do the evaluation of the case, and also a homework question is given to you related to the today's topic. So you must go through the e-notes that I have uploaded on the portal, and then you have to perform the homework. You have to write the definition of headache, write the classification, and you also have to evaluate the particular case. So this was all about headache. In the next lecture, we are going to start with the description of different types of headache. Like in the next lecture, first of all, we are going to discuss about the primary headache. And in the next lecture, we are going to discuss about the secondary headache. So this was all about today's lecture. And I hope you have understood this session properly. This session is powered by Digital Version 2.0 Jyoti VIDYAPEETH Women's University. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture with primary headache. So this was all for today. Thank you very much. Have a good day.